the pride and the passion, ever onward, ever upward to new heights. We picked up their banners and started to shake the world on its axis for everyone's sake, informing the voters of pertinent facts and calling on Congress for praiseworthy acts. Remember the pride and the passion of those who stand for our rights. We will carry the pride and the passion, ever onward, ever upward to new heights. On things international, we have perspective. On national issues, we're always effective. We want what is best for the red, white, and blue, constitutional rights and good government too. Remember the pride and the passion of those who march for our rights. We will carry the pride and the passion, ever onward, ever upward to new heights. We practice the art of gentle persuasion. We argue politely on every occasion. With great resolution, we carry our mission of social well-being to each politician. Remember the pride and the passion of those who march for our rights. We will carry the pride and the passion, ever onward, ever upward to new heights. We see as our duty the need to promote increased registration to get out the vote. Fair representation has long been our aim. Election reform is the name of the game. Remember the pride and the passion of those who march for our rights. We will carry the pride and the passion, ever onward, ever upward to new heights. While some people think we are decent but dull, they know in their hearts we have power and pull. With passion and pride we will march through the forest and carry the banner 10,000 years more. Remember the pride and the passion of those who march for our rights. We will carry the pride and the passion, ever onward, ever upward to new heights. The pride and the passion.
Welcome everybody to the November meeting of the League of Women Voters, Leelanau County. My name is Vina Meixel and I am president of the League. Our League became independent about a year and a half ago. We joined 400 leagues throughout the nation, studying and advocating for issues, informing voters about candidates, and getting out the vote. The League is nonpartisan. That means we never ever support candidates or parties. But I would like to recognize the men and women who were candidates this year. They are to be commended for the time, energy, and resources they put into their campaigns. The Leelanau League currently has 106 men and women who are members. To join the League, you must be 18 years of age or older and an American citizen. For more information about us, there are brochures by the door, and if you would like to be notified of our events, please write your email address legibly on the list by the door. You'd be surprised how many I enter and come back as not being deliverable. We've had a spectacular first year, as you saw in our PowerPoint presentation. During the past 2 months, many of our members have been involved in registering and informing voters. Joe Walker has been involved in contacting all county officials running for office and entering their responses on vote411.org. We distributed 750 printed voters' guides throughout the county and learned that in 2 years we will definitely need more. And then there were the forums. Among the 4 we sponsored or co-sponsored this year, we reached a total audience of over 500 people. Before we begin our program, I'd like to remind our members to stay afterwards for a business meeting. Leelanau County is the home of many retired teachers and administrators. The idea for these 2 educational programs came from Henrietta Barnes. She enlisted the help of Ty Wessel, and together they put together the speakers for last month and today. Our program is being taped for Up North TV 2, Up North 2 by Tom Slater, who's over there, and it will also be available on our league website in a few days. Ty Wessel is the moderator and a participant in today's program. A former school superintendent for Northport, Ty served as Director of Instructional Services for the Traverse Bay Area Intermediate School District. After retiring from that position, he became the coordinator for the Leelanau County Family Coordinating Council. A member of both the Lions and Rotary, Ty volunteers for almost every community service organization you can imagine. And most recently, he was just elected the County Commissioner for District 4. Well, that's a welcome to you, Ty.
Thank you. We have a tough job to do today because we have just an hour to cover 2 important topics. And as we can see here, we're going to start out, we're going to talk about poverty, achievement gaps, and then we're going to conclude today's session by taking a look at how we evaluate principals and teachers and school staff on making sure that all kids are learning. I wanted to start today by telling you that the United States leads the world in the achievement gaps between rich and poor. Our gap between the higher income and the lower income achievement gaps is a bigger gap than any other developed country in the world. We can't fix education unless we fix the poverty in our country. I'd like to start out with a slide, and this is a quote from Diane Ravitch, who used to be with the George W. Bush Office of Education. She's a leader in thinking about school reform, and I want to read this to you because I think it speaks to our topic today. Education is not broken, it is not failing or declining. The diagnosis is wrong, and the solutions of the corporate reformers are wrong. Our urban schools are in trouble because of concentrated poverty and racial segregation. Public education is in crisis only so far as society is, and only so far as this new narrative of crisis has disabled it. We looked at some data last month when Mike Hill was here, superintendent of the Traverse Bay Area Intermediate School District, and we saw how we're doing as a region in education, and we're doing well. And our best and our brightest and most fortunate students are doing really well. But we have across this state, across this country, a tremendous gap between low income and high income. It used to be between black and white, it used to be between racial minorities and majorities. We've solved some of that, but now we have to address the issue of poverty and achievement gaps. I'd like to show you one more slide before I introduce our guest. And this is from fall 2012, and it's put together. Each one of those dots represents a school district in Michigan. Every school district in Michigan is represented there, and every charter school in Michigan is represented there. And if you look over here on this bar, you'll see that this is an indication of the percent of the students who are on free and reduced, or the percent of the students who are proficient on the MEP test. So the higher this is, here we've got some schools that are 100% of their students are proficient. A lot of them up here in the 90s. If you go here, here's the schools that are 100% of the kids in that school are on free and reduced lunch, indicating that there's some poverty involved. And look at the inverse relationship between the number of students in poverty and how successful they're doing in our school. Now, we do have some examples of high poverty schools that are doing pretty well. But most high poverty schools are being challenged by the achievement gap. We're going to first today hear about poverty, then I'm going to take just a couple of seconds, and a minute, to talk to you about what some schools might do about it, and then we're going to shift gears. We're going to go to Chris Parker, and he's going to talk about a new initiative in the state and in our region and in Northport about evaluating teachers and evaluating staff. Our panel today, Mary Maroy, and most of you know her. She's a former director of Department of Human Services. She's a community advocate. She's on the Community Mental Health Board now. She's on the DHS board now. She is one of our speakers on poverty. Then we have Jim Roulette, who comes out of the business world, worked at Dow Chemical, has a degree in economics, and he, for how many years, Jim, have been working with the Poverty Reduction Initiative? 10 years.
Times 2, yeah.
10 years. Times 2, 10 times 2 is 20 years. And making a difference in poverty in our region. Then Chris Parker, new to Northport, not new to Leelanau County, used to be a principal in Traverse City Schools, also worked for the ISD, special emphasis on special needs and instruction. And so here's our panel of experts, and we'll start with Mary and Jim.
You know, I have a voice that really projects, so tell me whether you think I need the microphone or not.
Yes.
Oh. You need to talk to my husband. He thinks that he can hear me when he's downtown and I'm at home. Okay, I've got some statistics that I want to give to you because I think you need to see what the picture is relative to poverty. You know, everybody's talked about where we're coming, out of a recession, where everything is getting better. We have more people in poverty today than we have had in the past 52 years. Now, does that tell you that things are getting better? They're not getting better. 46.5 million people in the United States of America are currently in poverty. For children under the age of 18, that poverty rate is 21%. Although children represent 23% of the total population, over a third of the people in poverty are children. Children. And when you are in poverty, I am telling you that you are living in a stressful environment. You watch your parents go without food so that you can eat. You understand that the lights are going to be turned off, that you're going to be evicted from your house. That kind of stress is not the kind of stress that you want to have when you're trying to learn. There are 24.4 million people in the United States who are living in extreme poverty. Extreme poverty means that your cash income is less than half of the poverty rate. So for a family of 3, that would be about $10,000 a year, living on $10,000 a year. We have people in this country who are making $10,000 an hour. So let me give you a little bit of information about what that looks like in Leelanau County. Beautiful, beautiful Leelanau County. I was the Department of Human Services Director here also, in addition to Grand Traverse. And I used to live in Leelanau County. I love this county. You have a population of about 22,000 people. Out of that 22,000 people, it is estimated that you have about 2,400 people living at or below poverty in Leelanau County. Go find them. It's part of the hidden America. That is a lot of people in Leelanau County. I would think that if we did a survey just randomly in Suttons Bay and stopped every other person and asked them, they would never guess that number of people. 2,400 people. So then you hear the pundits on the radio and on television say, well, there are all of these people living on welfare. These 2,400 people are living on welfare. Here's the truth. The truth is powerful. 31 people in Leelanau County are getting cash assistance from the Department of Human Services. 31 people out of 2,420. Now, who do you think is taking care of the rest of those people? Leelanau Christian Neighbors, organizations that are a part of churches, places where people can go to get a meal, neighbors. I'm not arguing that those aren't the people who ought to be taking care of the poor in the community. I'm saying government's not doing it. Government is not taking care of people. Out of that 2,420, you have 684 food assistance cases. Now, I will also say that there are people who are eligible for food assistance that are at a higher level than 100% of poverty. I believe that you can be at 130% of poverty and receive food assistance. But the average amount of food assistance that is given to an individual in this county is $114 a month. Very few people that I know can survive on $114 a month for food. Most people need more than that. And the big issue, the big number that nobody ever seems to talk about is Medicaid. This, and my statistic is actually prior to the Affordable Care Act. But prior to the Affordable Care Act, there were 2,145 people in Leelanau County who were on Medicaid. Medicaid is a welfare insurance program. And people will argue, well, that's because the poor go to the emergency room. That's why that number is so high. And the ticket, the price ticket for that amount is about $10 million a year just for Leelanau County. $10 million. We spend $55,000 on those 31 people giving them cash assistance, but we spend $10 to $12 million on Medicaid. And the greatest majority of that Medicaid money is not spent on children. It's not spent on adults, on adults that are part of families. It is spent on long-term care. 70% of that money is for long-term care. Okay, I'll turn it over to Jim in just a second. You know, we know that minimum wage went up to $8.15 an hour on September 1st. You know, my response to that is yahoo, but not everyone agrees with me. A mom with 3 children who is working full-time in a minimum wage job is going to make $16,952. If the poverty rate for a family of 4, a mom and 3 children, is $23,850. So already, she's working full-time, she's doing what society expects her to do, and she's not even making a living wage. She's making almost $7,000 less than the poverty rate. And I have a niece who is a daycare provider, and so I said to her, okay, this woman has 3 kids. What if 2 of her kids were in school, but one of them she had to provide daycare for? And she said, well, that would be $7,000 for one child a year. So, well, what about 2? That would be 13. What if all 3 of them were not school age? $19,760. Gross income, $16,952. But if she has to put her kids in daycare, it's even more than what she brings home. That's why people may not be taking a minimum wage job if they're not. It isn't because they're lazy, and it isn't because they want to keep the $114 that or the average case on a TANF case is $329. Not because they want to keep that $329, it's because they can't afford to. Anyway, I'm going to turn it over to Jim, who's going to talk a little bit more.
Uh-oh. I'm going to stand up because I'm in the spotlight here. Actually, I'm going to get out of the spotlight, but I am going to stand up so I can keep a little bit better eye on you. And besides, I saw Ty walk around with a microphone, and he seemed to do a pretty good job, so I'm going to try that. Now, I mentioned Ty, and you know, he didn't get, and I realize this is the League of Women Voters, and you can't do anything that's not right down the middle. But a whole lot of people have congratulated Ty on a victory, which wasn't very long ago, like about 11 o'clock last night. And I just want to say that I think we have to be careful that we don't give him too many congratulations and too many pats on the back, because you know, I think that we're going to support every word that he says from now on, and we're not going to do that. Okay. You do have a little handout, a little flyer on each chair that has to do with the Poverty Reduction Initiative. So you don't have to listen almost to anything I say, because most of it's in there. But I have only 2 things that I'm going to say that I want you to go away with, and I'll tell you when I get to each of them, so that's what you should remember. And it's pretty easy, just 2 things. Another thing about today's gathering, when Ty invited Mary and me to come to this gathering, he said, hey, we want you to talk about poverty. And then when we looked at the announcement, it's all about education. So I said, well, somewhere along the line, we better work education into this discussion about poverty, because poverty is the topic. Okay, I'm up to one of the things that I'd like you to take away. And that is the bottom line. And that is, education is the answer to eliminating or reducing poverty. There isn't any other answer. And in the political world, you get a lot of arguments with that, whether it be the economic system or even the human services system. The bottom line is the answer to eliminating poverty is education. Okay, now I'm going to go back to the Poverty Reduction Initiative, and you'll see a little bit where that fits in here and there. About 10 years ago, when this PRI, as we call it, was started, one of the first things that group did was to take a look at the issues. What are the issues that are important and impinging on people in poverty? And the presumption was, we can solve those issues, we'll probably eliminate poverty or reduce it dramatically. So I'm going to give you those in descending order. In other words, in the order of importance as they were prioritized. The first one was jobs and economy. What a surprise, huh? And some would say out there, that's the whole issue. Get those jobs out there and get a humming economy and poverty will disappear. Well, some of you may know, may not, but as of November 1st, there is listed in just Grand Traverse County 1,225 jobs that are not presently being filled. Now, I'll admit that list didn't pop up overnight, but it's been emerging over the last number of months as some recovery has occurred. In the region, that would be the 5-county region, it's 2,627 jobs, about twice as many as just in Grand Traverse County. And interestingly enough, the number in Leelanau County is only 22. I don't know why it's so low, but it is the lowest among the 5 counties. That means people are smart enough to get a job here in Leelanau County, or maybe they're not looking for a job. But in any case, there are only 22 jobs listed right here that are going unfilled at the moment. Okay, the second issue is education and training. So what a surprise. We can have all kinds of jobs out there, but if people have no skills and have no training to do a given job, well, they're not going to be able to get one of those jobs. So that's the second one. And incidentally, relating to that, there's always this discussion about, well, you can make it if you just work hard. And I think Mary would be quick to point out, no, just working hard doesn't do it by itself. You better have some skills to go along with it and work hard. And between the two of them, you can be successful. The third one is housing. We don't need to go into detail on each of these, but there's probably nobody in the room that wouldn't agree that for most people, housing costs are a pretty significant part of the household budget. And that's certainly indicated by the constant discussion about affordable housing and who that applies to. The fourth one is health. And again, most of us would recognize that if we don't have our health, it's pretty hard to do a job, much less raise a family. If you're moving around and unhealthy, you really need to have health. And that doesn't even address the question of how you pay for it, but health is critical. The fifth one is attitudes. We called it social attitudes in the beginning, and again, we could go into some detail here, but that's sort of a catch-all for a lot of different things. And in my view, it kind of includes getting along with other people. That would be another simple summary. But attitudes of individuals in poverty have a lot to do with why they might remain there. And then the last one is early child development, and that certainly relates to education, to say the least. And I'm going to touch on that again in just a minute. We learned very early, or quite early in the history of the Poverty Reduction Initiative, that aside from these issues, helping people out of poverty, and for that matter, preventing them from going there, has a lot to do with working with folks on a one-on-one basis. It's all about relationships. And most of us in the room probably have enough relationships that can help us solve practically any kind of problem that we might run into. But people in poverty don't necessarily have those connections. They may be connected with other people in poverty who don't have any connections either. So PRI figured out, not only on its own, but from the guidance of some national experts, that if you're going to help people out of poverty, you can probably best do it on a one-on-one basis. And that translates to local, not necessarily some broad state or national program. So Mary's going to tell you a little bit about how that strategy of helping people one-on-one unfolded.
How rude of me to sit. We started something in Grand Traverse County that actually, part of it has moved here into Leelanau County, but we tried to work on this concept that it was about relationships, that if you could create for people in poverty relationships with people who have experienced some success, that you could change the paradigm of their situation, and you could perhaps get them out of poverty and keep them out of poverty. So we started this program called HelpLink. Actually, I'm going to have to make this quick because we don't have a lot of time. It really didn't start with HelpLink. It started with a navigator program where we were hooking people one-on-one, but it evolved into what is called HelpLink. HelpLink in Grand Traverse County is a storefront. It is at the corner of Division, or at the corner of Garfield and Munson, across from where Arby's used to be. And it is a building owned by the Faith Reformed Church, and 2 days a week it is open. And we've never once advertised at all, and we constantly are having people come. And it's people who are struggling in the crisis of poverty. And they come in, they are hooked up with a volunteer who is a navigator. A navigator is a person who works with a neighbor, the person coming in, and try to get them from point A to point Z. And there's a lot of stops in the middle, but basically they come in, they are welcomed, they're going to sit down with somebody who is going to listen. And it's interesting that I say that, because there are some of us who believe that people walk away from helping professionals worse off than they were when they went in the first time. And so we commit that if we do nothing else with the person that comes in crisis, that we are going to sit there, we're going to look at them, we're going to have eye contact, and we are going to listen to what they have to say. And then we are going to try to help them break things down into small pieces, and we're going to help them get through the crisis. Our original design was to not do crisis intervention. Our original design was to immediately begin working with them toward getting out of poverty, toward getting a job, toward getting education, toward hooking up with someone that could help them get into a job. And we found out that we couldn't have that conversation, that you have to meet people where they're at. And the people that walk into HelpLink, they're in crisis. They're getting evicted, they're getting their utilities shut off, they're getting their heat shut off, they've got a kid who's in crisis with the child welfare system. There's something going on that puts them in crisis. And when they are in crisis, just like when children are in crisis, you cannot move forward. You've got to meet them where they're at. And so that's what we do. But we discovered in a very short period of time that that wasn't going to be enough. That if we really wanted to move toward exiting poverty, that we had to go beyond this. And out of this came what is called the Little Collaborative. And one piece of that Little Collaborative, the beginning piece, is HelpLink. The second piece is what we call the Family Partnership Program. Used to be a program all on its own, out in the community, was started by the Presbyterian Church, has now become very ecumenical, and is not attached to the church. It is actually a 501c or 401c3, and it is a program of mentors. Again, volunteers who want to work with families who are struggling in the crisis of poverty. And in HelpLink, it might be somebody that we engage and we see that they're ready to turn the curve, or they're ready to move forward, and we say, this is an aha moment. Let's hook them up with a mentor in the Family Partnership Program and see if they can move forward. And that is the objective.